Well, there's this something called COVID-19. I don't know if you've heard of that, but been in the news a little bit.
Yes, it has. And there have been rising cases in Winnipeg over the course of September. And over the summer, in late summer it increased in Manitoba. So we had a number of days where we were getting very few low new cases, and the level of active cases was incredibly low, and now that's no longer the case. Looking up on Public Health Canada's assess case count page, the number of active cases in Canada as of October 4th, which is when they have the most recent data for, and rare recording on October 4th. The active cases per 100,000 persons in Canada is 44. The rate is highest in Quebec at 86 active cases per 100,000 persons. And looks like it's second highest in our province, Manitoba, with 51 active cases per 100,000 persons. So that's not a great position to be in.
Yeah, no kidding. It seems as of today, anyway, it seems like restaurants seem to be. There's been a number of cases. I'm just looking at CTV, Winnipeg News, and it looks like there was 36 new cases today on October 4th. I guess there's also 6 possible COVID exposures in Winnipeg. One of them being at Hooters, who doesn't love owls, and I guess it happened on the 24th of September. Bourbon Street Billiards on Vaughan Street. I don't know if that's a restaurant, though. I guess that's more of a pool hall. Jeez, I haven't been there since I was a kid. And Earl's Polo Park in Portage Avenue there. And Montana's at Polo Park. And someplace called, I don't know if it's a typo here, but it looks like it's Crispy Bunch on Sargent Avenue, but there's no vowels. It's just like on the name here, which is weird. CRSPYBNCH. I don't know what that's about, but I don't know if it's a CTV, but I've never heard of that place. I'm guessing that's a restaurant of some sort.
Yeah. So I'm looking at some info that's been released by the province. So the top health districts as of October 4th for active COVID-19 cases: River East, downtown Winnipeg, which includes much more than just what we'd normally consider downtown, Seven Oaks, Fort Garry, and River Heights. So the total active cases, this is total cases not per capita, is 128 in River East, 119 in downtown Winnipeg, 65 in Seven Oaks, 57 in Fort Garry, and 45 in River Heights. So it's certainly entrenched. It looks like we're having a sustained outbreak in Winnipeg. We've been having rising cases for a number of weeks by now.
Yeah, and doesn't look like to go away anytime soon, which is going to make Halloween kind of interesting this year, I guess.
Yep. Did you see those remarks from Pallister a few weeks ago in the Chicken Chef?
Remind me here. I'm just...
Well...
oh, yeah. Yes. Okay, is that the armchair critic?
Yes.
Yeah. That's what he's saying. You start questioning everything that the health leaders do, you're going to encourage your kid to be doubtful and fearful, and it wouldn't be a good thing to do.
Yes, that's what Premier Pallister said on September the 14th at a press conference where he was in a Chicken Chef without a mask.
That is a Chicken Chef, eh?
Yeah.
He brought his own frickin' sign there, too.
Yep.
He's standing in front of a Manitoba restart, #restart sign, so he brought his own little billboard with him.
Yep, in front in front of the old fountain drink. Fountain. Yeah, drink fountain. Yeah.
Oh, that's funny. Just an average Joe, eh?
Yeah.
Just an average Joe.
Yeah, average Joe.
Joe Six-Pack.
Out at the Chicken Chef, giving a press conference without a mask, in an confined indoor space. Some of the reporters had masks, from images I've seen. And I'm sort of just... Obviously, a lot has happened since, and where not public health experts, but I don't really think that was an appropriate reaction to concerns about public health policy from the public by the Premier. Because I really think that as a political leader, he needs to communicate on pandemic safety, including school safety, and address any concerns parents and the public have.
And not only that, like who's he to talk about encouraging kids to be doubtful? But I encourage kids to be questioning, not to just accept whatever someone says. You know, I think critical thinking is a useful skill, and I would like my kid to learn that, and they don't have to be fearful. You just gotta think about where the information's coming from, right?
Mm-hmm.
Yeah, but Pallister, I wonder how his numbers are doing lately.
Yeah, that'll... Yeah, I'm not sure when the latest polling has been. I just think that we've... So at least a few weeks ago, the public health officer was saying that we were losing track of the fundamentals in Manitoba. And by the fundamentals, he meant basic social distancing. Basic important measures like that. But I just... And when I go on Facebook, or sometimes I'll come across posts from people who aren't necessarily conspiracy theorists, who outright don't believe that there's a pandemic occurring, but people who try to downplay it a bit more than I'd say is justifiable. They'll say, oh, only so many people are in ICUs. This isn't, this hasn't overwhelmed us yet. We really shouldn't be that scared of this pandemic. And that's really a wrong tack to take. It's a very new disease. It spreads very rapidly, and if it gets out of control, it absolutely will overwhelm the healthcare system. You just have to look to Italy to see a case study in that. And we've been successful at keeping our active cases down and sheltering vulnerable people, mostly thus far, because we've taken it seriously. But when I see these, don't be afraid, this is all fear-mongering type sentiments, people losing track of the fundamentals, as it were, I can't help but notice a parallel between that and the reasoning and messaging we got from Brian Pallister himself over the summer when he was trying to re-encourage reopening, when he was saying we can't live in fear, when he was claiming that the province was fighting against CERB, which was a necessary financial relief measure to ensure service workers could survive without income during the pandemic. When I hear all that, I can't help but notice or think that this is sort of feeding in to people not taking the pandemic as seriously as they should be.
Yeah, I agree. He's got a platform that, when he speaks, people, they listen, right? He's the premier, for Pete's sake, right? So when he says something, he's influencing people. So yeah, he's absolutely part of the problem. And I get, and those people that think that this disease, it only affects the elderly, sick people and stuff like that. Yeah, for the vast majority it is. But that being said, we still need our health system to be working. And if everybody is just not doing their part by wearing masks and such, and not social distancing, then, then the hospitals will get overrun. And then what's going to happen if you do have an emergency and the hospitals are overrun with the patients, you know what I mean? They think it doesn't affect them because they're not old, right? But it could, or it could affect someone that they love, right? That there's no ICU beds for someone that, say, it's been in an accident or something. I don't know, but some tough choices. I don't know, how they go about choosing who gets a bed and not. But why push it to that point where they have to do make those choices?
Yeah,
you know what I mean?
Yeah, definitely. And there's also, it's still there's still a lot of research going into SARS-CoV-2, the virus that causes COVID-19, and people still aren't exactly sure what the long-term neurological effects of the virus are, even in mild cases. So there's possible unknown downsides, potentially, that we just don't have a lot of information on, and that definitely should be factored into how seriously we're taking the risk of COVID-19.